Hi everyone. Today we'll discuss spinal deformities, an important topic in orthopedics and rehabilitations. These conditions not commonly affect the structure of the spine, but also influence the neurological functions, pain, and overall quality of life. As the physiotherapist, our role is vital in managing these cases historically. Shall we start? Coming to the point, the human spine normally has four curves: cervical, lumbar lordosis, thoracic, and sacral kyphosis. Deformities occurs when these curves are exerted or when abnormal curves developed. The three main types are scoliosis, lateral curvature with rotational diagnosis when the curve is exerted to the 10 degree. The kyphosis, the excessive posterior convexity of the thoracic spine, can be rounded and angular type. A spondylolisthesis is a forward slipping of one vertebra over the another one. Often it occurs in L5 and S1 of vertebrae. What are the mechanism of these curvatures? First of all, the scoliosis. Why does the scoliosis occurs? It is occurs and due to the idiopathic method. The most common heredity often to in adolescence, the congenital are due to vertebral malformation. Example, hemivertebra progress quickly. The paralytic vertebra muscle imbalance from the conditions like cerebral palsy or polio. The non-structural maintenance like compensatory muscle activations. Example, leg length disparity or from the pain of spasm. What are the main mechanism of kyphosis? The mechanism of kyphosis can result from the localized injury of vertebral fracture or pod disease, TB spine, metastasis, the generalized bone disease or ankylosing spondylosis, osteomalacia, Page diseases. Growth factors may be influenced like Schumann's disease in adolescents. The postural changes may be occur due to poor posture or osteoporosis in the elderly, leading to progressive stooping. What are the mechanism of spondylolisthesis? Types of spondylosis: ischemic, dysplastic, degenerative, pathologic, and traumatic. That is, ischemic means most common due to pairs of interarticular defects. Dysplastic is a congenital vertebral abnormalities. Degenerative is a facet joint osteoarthritis in elderly. The pathologically may be occurred due to bone disease, like TB spine, something else like that. Traumatic injuries means an acute injury or traumatic injury. Then coming to the managements, these are the general managements are realigning and protect the spine, stabilize to prevent the progressions, reduce the pain and improve the functions, enable the early rehabilitation and restore the independence. Maybe the treatment is individually mild deformities may only needed observation, while the severe ones may be required surgeries too. When what are the conservative managements? The conservative managements or methods include like observation of for mild scoliosis lesser than 20 degree in children, bracing them. Example, Milwaukee brace or Western way brace for scoliosis occurs in 20 to 50 degrees of curves. The physiotherapy are used to treat like spine mobility exercise, muscle strengthening exercise, like scientific exercise approach of scoliosis is based. Traction and bed rest may be required for the fracture cases or severe pain cases in the scoliosis affected patients. The medications like analgesics and anti-inflammatory drugs, muscle relaxants, and steroids for unstable fractures may be required for the medications. Uh, Maybe what are the surgical interventions? The surgical interventions are uh, conservative treatment fails and deformity maybe gets severe. The surgical treatments like spinal fusions, instrumentations, decompressions, vertebroplasty, kyphoplasty means disc replacement, and radical disc surgery may be required. What is meant by spinal fusions for scoliosis? Less than 50 degree spondylosis or rigid kyphosis. Instruments like Hagran rods, or pedicle screws for stabilizations. The decompressions like laminectomy or anterior approaches to relieve the nerve pressures. Vibroplasty for the osteoporotic fractures. Disc replacement to preserving the motion of the degenerative cases. Radical surgery means for severe TB spine. It's in Hong Kong procedures too. Hong Kong is the invention of these procedures, not these, that procedure. What are the rehabilitation takeaways? Successfully management combines early diagnosis, tailored treatment, and comprehensive rehab. Rehabilitation includes strengthening exercise for weak muscles, the preventing contractures, improving posture and spinal mobility, uh, educating the families for the long term. Our main aim is to preserve neurological functions to improve the quality of life. Let's summarize this topic. The spinal deformities are complex, involving structural neurological function amplification. The physiotherapy plays a central role in conservative management and post-operative rehabilitation. The multidisciplinary approach or care ensures the better outcomes for the outpatients. Thank you. Hope you will understand this topic. Until then, next session. Bye.